Namaste, my name is Dr. Anshum Aneja and I am a pulmonologist in Gurgaon. So let's understand what are the symptoms that one can expect in the winter season. Firstly, your cough may increase. It may be dry or it may be productive. Usually, dry, irritating cough that continues and does not allow you to speak properly is one of the earliest symptoms of a poor asthma control in a weather change. Sometimes patients may also have infections, and this may lead to cough with phlegm protection. A lot of patients come to us and say that the color of the phlegm has changed recently. If you notice a change in the color of your phlegm, that could also be an indicator that there could be a recent infection that you've had. The second factor that can affect you will be your breathlessness. Well, if you are able to do your routine activity that you were doing earlier but now experience some discomfort, some hesitancy and difficulty in doing that activity, then it means that your breathlessness may have increased because of an asthma flare-up. At this point of time, it's also important to see whether you are regular with your inhalers. Thirdly, you may experience chest tightness or chest heaviness. A lot of patients come and tell us that they hear a whistle kind of a sound from their chest. This whistling sound, which doctors call as wheezing, is very common in asthma. And when the season changes, you may actually hear this wheeze. If you are hearing this wheeze, then your symptoms have definitely worsened and it's time to think about your asthma management. Let's look at how we can prevent these symptoms from worsening. The first step in doing that is to ensure that you have an asthma action plan. I hope most of you have heard about asthma action plans from your doctors. Just like you prepare for an emergency by means of an emergency kit, or when you're traveling, you keep certain medicines handy. It's important for asthmatics to have an emergency plan with them. This emergency plan, called as the Asthma Action Plan, can be formulated in consultation with your treating doctor. This often tells you what to do in case your symptoms have worsened. In this case, monitoring with use of devices like peak flow meter or looking at the red flags and signs that tell us that asthma has worsened may be helpful, and your doctor will tell you what to do if you are in the green, yellow or the red zone. Based on it, you may be knowing how to increase your inhaler, what medicines to add next, when to visit the doctor and when to start oral corticosteroids. So how do we tackle this dry air is the next question. How do we take care of the temperature changes in the air that we breathe? Now firstly, something that is really helpful is humidifiers. A lot of people consider humidifiers in their house during winters. But they often forget that humidifiers can also be a source and nidus for infections if they are not kept properly. So we must know about the humidifier that we are using. Is it a cool mist humidifier or a hot humidifier? You would actually prefer a cool mist humidifier, and the humidification that is being done by the humidifier should be optimal to the tune of 40 to 50%. Too much humidity can also be detrimental. It can also cause a feeling of congestion, tightness and difficulty in breathing. So the optimal humidification that you would want with a humidifier is 40 to 50%. The second thing using a humidifier is that the water that we use for humidification has to be either a mineral water or water which is a filtered water. Do avoid tap waters because they can be sources of infection themselves. Patients should change the water that they use for humidification on a daily basis, and also cleanse the cavity or the bowl of humidifier in which the water is stored on a regular basis, because that can also develop a layer of mold within. Often humidifier is used along with the heaters that are used. And it's very important to understand that if you're using heaters with dry blowers that have a lot of blowing air, then that can be detrimental for your asthma control. So usually oil heaters or heaters that do not cause too much of a dry wind would be better options. Air purifiers are another option that you can use to tackle the changes that the weather and the cool wind might have had on you. Usually air purifiers have multiple layers, of which there is a layer of activated charcoal that also takes care of the humidity in the air. It's also helpful that air humidifiers take care of the indoor pollutants and the indoor allergens in our air. Indoor allergens and pollutants are often a commonly overlooked cause of deterioration in our health, starting from the blankets to their covers, carpets, rugs, mats, heavy upholstery, curtains, and also the stuffed toys that are in and around the children's beds. These are very common sources of indoor allergens, and they may be responsible for worsening of your asthma symptoms, especially in winters when you are mostly indoors with tightly packed doors and sealed windows. It's important that you clean this upholstery and these beddings on a regular basis, preferably with warm water. This also helps in prevention of dust mites, which are one of the commonest cause of indoor allergy. So taking care of the indoor air and humidification can go a long way in preventing asthma attacks. So I hope this video was helpful for you. If you like this content and wish to hear more about asthma, lung health and other diseases which concern the lung, then do like, subscribe and share this channel. Also, spread it to your friends and families who may wish to hear about this as well.